Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Morneau. A recent report highlights how some immigrants and refugees are unable to access public benefits for which they are eligible due to language barriers. Joining us to share more about this follow-up report to last year's Essential but Excluded report from New Mexico Voices for Children is the organization's Deputy Director, Amber Wallin. Amber, thank you so much for joining us.
Great to be here, Anthony. Thank you.
Okay, let's start off with the report, this follow-up report from last year that your organization did with immigrant advocates and faith-based community groups across New Mexico. What were the general findings of this report?
Well, what we found when doing this report is that while so many immigrants and refugees in our communities are really essential to our workforce, raising families in the state, kids in our schools, that unfortunately many of our immigrant and refugee families and communities were missing out on some benefits for which they were eligible. Benefits that they're missing out from largely because of language access issues. And we know that this is a problem for the whole state because while all of our kids and our families have faced some big challenges due to the pandemic, we know that most of our community members have been able to access benefits for which they're eligible, benefits that can really create a lifeline during really hard situations, but that those barriers were even higher for many immigrant and refugee communities because of those language access issues.
Okay, could you share with us how your organization took a look at this issue? What were the metrics? How did you measure this?
That's a great question, Anthony. So what we started, let me give a little bit of background maybe on how we got here. Last year going into the pandemic, what we saw and what we heard from many community-based organizations that we work with was that many immigrants in our communities were ineligible or unable to access benefits. So what we saw, we did some research and we found out that nearly 70,000 New Mexican residents who are immigrants were ineligible for federal relief for those economic impact payments, for unemployment insurance, despite the fact that immigrants are overrepresented among our essential workforce. They were keeping our economy running, raising kids in our state, but ineligible for a lot of those benefits. So we did a lot of research on that issue. And with a number of our community-based partners, push for some changes and some relief to help our families, to ensure all our families could make it through the pandemic and be able to thrive after. But as we worked on that issue more, we realized that there were a lot of other immigrant and refugee communities in the state who actually were eligible for benefits, but they were not able to access those benefits because of language access issues. And this was brought to light by a number of our community-based partners who work especially with refugees in our communities. And many of those immigrant communities don't speak Spanish, they don't speak English well. And so there were just tremendous barriers for them accessing really crucial food relief, food security, basic safety net things that they were eligible for. But unfortunately, because of a lack of translation and interpretation services, were not able to get those benefits that really would have provided a crucial lifeline during the worst times in the pandemic.
Okay, so you mentioned immigrant refugee communities having difficulty accessing, information, important information during this pandemic. I think we're all familiar with how important it is to have accurate and factual information at this time. But can you be a little bit more specific on what community groups were speaking up and saying this is a problem in New Mexico?
Yeah, that's a great question. Well, we worked most closely with this project to do the research. We worked most closely with a group called United Voices for Newcomer Rights, a refugee organization, the New Mexico Asian Family Center, and the New Mexico Black Leadership Council to research the challenges faced by refugee and immigrant communities in New Mexico. And so in the report, we bring attention to additional groups of New Mexicans, specifically Asian and Pacific Islander communities and African immigrants and refugees who speak languages other than English or Spanish, who were eligible but unable to access benefits. And so what that looks like for families, like what that might look like for a family who's facing challenges, is that a family might have lost income. They may have lost their job. They may have been eligible for example, unemployment insurance benefits, including the extra benefits that were provided by the federal government. But because there may not have been applications or translation or interpretation services available, those immigrants may have missed out on those. Then at the same time, they may have been homeschooling their children, like many parents in our state, like I was for a year, having a kid at home, doing that while trying to work and support your family, but had an additional barrier because class materials and all of the educational materials were not available in languages largely other than English, usually not available even in Spanish. And so that created situations for many immigrants and refugees who were maybe unable to access or even maybe didn't even know about certain benefits, while also trying to take care of their kids, because we found on average in our research, most families were raising at least 2 kids in the home. And then you add an additional layer about challenges that refugees who may have been fleeing their country were facing already when they got to the US. And it just created an intersection of a lot of different challenges for so many families that we know are really crucial to our cultural diversity here, to our workforce, and to our overall well-being as a state.
Okay, so when somebody in the communities that you described run into this problem of accessing important information, and they're already impacted by the economic factors that happened in our state due to the pandemic, what's the ripple effect to people in these communities?
I think that's a great question and a great way to think of it, because we know at the heart there may be one family that's facing this intersection of challenges, but the way that ripples out is it impacts an entire community. And from our perspective, we always think about what kind of a challenge does that create for kids that are in our schools. So we know that about 20% of our New Mexico population is either an immigrant or the child of an immigrant, and that more than 1 in 10 kids in our school systems are being raised by immigrants. And so we know that when there's challenges at home, that those impact a child's ability to do well in school. If a family is not able to access food relief when they're facing a really hard time, then that means that their child may not be ready to learn in the morning. If they're in a situation at home where they may not be able to access crucial wage supports or unemployment insurance supports, that means that family may be having trouble meeting the most basic needs. And we know that that can create big challenges for kids, not just in an immediate sense, but in a way that could actually impact child development and limit opportunities for kids later in life. And when we know that a number of families in our state are facing such big challenges, in addition to the challenges that all of our workers and our families in our community were facing due to the pandemic. It's just really imperative that we address those issues amongst those in our communities that need the relief the most if we want to move forward as a state.
It's no secret that so many in New Mexico are struggling. The state's well known for being one of the poorest states in the country. But what are the facts and data saying about how many folks in this community may be struggling already with the finances before the pandemic hit, living check to check? What do you know about that?
Well, we know that economic challenges are higher for immigrants and even higher for refugee communities, especially refugees who may be fleeing really dangerous situations and may come to our country with little more than what they were able to travel with. I think that's at the forefront right now with many Afghan immigrants in our state. And so we know that refugees have often the highest economic challenges when they come in. We also know that immigrants in our state, once they're established in our communities, though they often face high economic barriers, and a lot of that does have to do with language access issues and sometimes with exclusion for really crucial economic relief programs that many families depend on. One thing I would lift up from some of the research that we've done that I think is key to mention is that despite those challenges, we also know that immigrants in our state, I mentioned, they are more likely to work in those essential industries, but immigrants are also more likely to start new businesses in our state. They contribute an enormous amount in tax revenue for our state. So our immigrant workers are really a crucial part of so many industries, but they contribute almost $1 billion a year in tax revenue that goes to supporting programs in our state that are really crucial for all of our kids and families. So we know there's a lot of economic challenges, but we also know that there's just massive economic contributions. And so during these times where we have seen so many of our immigrant families facing big challenges, it's really crucial that we step in and identify these things. One of the things we discovered in our research was that about 80% of those families had lost income or lost wages since the pandemic started, and that over 70% of families had challenges with affording food. And so, it's an interesting thing that you have these things happening parallel, that you have families who are disproportionately starting businesses and contributing in tax contributions and working in essential industries, but also at the same time to access those really crucial relief programs that so many of our families needed over the past year and a half.
Okay, so there's important information that needs to get to the people who are being impacted by this, but there are also maybe some concerns from other folks in our state who may be wondering, why are my tax dollars going to this relief effort when I'm struggling myself to put food on the table? What's your response to those folks who may be saying that?
I think that's a great question, Anthony. And, I think there's a few different elements to lift up. And one is that fact that immigrants in our communities are really vital to not just our cultural diversity and all of the benefits that brings to our state, and really is crucial to who we are and our state identity, but that there is an incredible tax contribution. Immigrants in our communities are starting businesses. They're working in our industries. They're a big part of our oil and gas workforce in the southeastern part of the state. They're raising kids in our state. They're spending money in our grocery stores. They're spending money at child care centers, and they're contributing that almost $1 billion a year in tax contributions. So I'd say that term, this is our money, this is my money. It's all of our community's money. We all contribute in taxes. Everybody who's residing in our states pays sales taxes, property taxes, income taxes. We're all contributing to these services that lift up our state, that fund our crucial education programs, healthcare, that are building roads, public parks, all of those great things that we all benefit from. Immigrants are huge contributors to that. And so that's part of it. And then also lifting up that really these are our community members, and nobody made it through the pandemic really well, especially not working class folks, lower income folks, middle income folks. Everybody was struggling during the pandemic. Everybody felt those economic impacts. And so what we like to look at are what are the ways that we can benefit everybody in the state. And one of the ways that we do that is ensuring that food security supports are available to everybody who needs them, whether it's refugee communities, whether it's longstanding immigrants in our state, whether it's people who were born in our state or moved here from other states or countries. We want to ensure that everybody who needs relief gets relief. And so one way to do that is looking at what are some of the barriers. And so we work on these issues for many different populations in New Mexico, but what we know is that we can't recover as a state. We can't thrive after recovery if we're leaving so many families behind, and especially if we're leaving kids behind.
Yeah, you mentioned kids. Some children of immigrants in New Mexico may be facing these same issues. They're going to school and trying to get an education here in our state. If they don't have proper nutrition, or if they are living in a household where parents are struggling to find employment, how is this going to affect this next generation of New Mexicans?
One of the things that research shows is that you mentioned food security for kids. And we know that New Mexico already had one of the worst rates in the nation of food security, that too many of our kids were going to school every day just without the proper nutrition that they needed to thrive. And we know that the pandemic made that worse for kids and families in the state. And so what that looks like, what research shows is, for example, when kids are food insecure, they're more likely to face disciplinary action. They're more likely to be admitted to hospitals, and they're less likely to do well on tests. So we always, it's easy to make that leap to, well, how will kids perform on a test if they're hungry? And we know that that's something that's real, but we also know it's disciplinary actions, it's overall health impacts. And so when we think about if families in our state are unable to meet basic needs, what that does long-term for our state's opportunities to success. As parents in the state, we're raising our state's future workforce, we're raising our state's future leaders, and it's just really crucial that they have especially the basic needs that they need to really thrive and grow up healthy. We know 95% of brain development occurs in those first 5 years, so we want to make sure all of our kids are fed and safe. And then as we move forward through a school system, that we have well-resourced schools that, kind of to your last question, that are not just supporting refugees and immigrants, but that are supporting all kids across our state. We know that when we really support those programs that matter most to kids and families, that's the way that we lay the path for future success for our state as a whole.
Now, you mentioned how immigrants and refugee communities in New Mexico are impacted by the lack of access to important information, but what about during this pandemic, healthcare in general? I mean, obviously there's issues with the pandemic, but healthcare in general, how big of a problem is this for immigrant and refugee communities in New Mexico?
That's a great question. And with this report, we actually didn't dig deep into healthcare access, but I'd lift up some other provisions that were happening at the state level and state level policies, some things that were really good on this front. I'd say, first, that so many of our state leaders really took the pandemic seriously from the very beginning and really took necessary steps to try to protect folks in our state. And one element of that was ensuring that everybody in our state had access to being able to get tested for the coronavirus, to get vaccinations later as they were enrolled. So I think that that's crucial to lift up, that many immigrants in our state, they weren't excluded from being able to access really crucial COVID health supports. And then during the legislative session, there was other legislation that was passed that helped support immigrants in our communities to help ensure that there was more equitable healthcare access for immigrants regardless of their status, along with ensuring that all members of our communities are able to access really crucial health support. So I say that there's some proactive work being done, especially at the state level, to try to protect New Mexico residents, to try to ensure that people have crucial support as they need. But as you said, there's longstanding barriers to accessing support in immigrant communities and just for so many of our families. And then added to that we have a system, a healthcare system, and certainly state supports that have challenges meeting all the needs in our communities, because for too long they've been under-resourced. And right when in 2019, under the new governor, when Governor Michelle Lujan Grisham came in, a big challenge was that many of our state agencies had a huge amount of vacancies, and those are systems and agencies that really serve all of New Mexicans. And when you have those agencies greatly understaffed, it makes it hard to serve New Mexicans and hard to provide supports to all of our communities. And so, it seems like those agencies were kind of just getting back to a halfway decent staffing level, and then the pandemic hit, which we know created so many challenges for our families and for our state workers as well.
So there's obviously so many issues and challenges here that New Mexico needs to address with this issue, but what are some success stories that perhaps other states have tried? What can we look towards as possible examples or solutions to these issues?
Mm-hmm. One of the things that we've seen a number of other states do is create really robust language access plans. So one of the first steps is gathering data on challenges that families may have in accessing certain state benefits and safety net programs that are available to all New Mexicans falling on hard times. But we want to make sure that they're not just available to our folks, but that people can access them. And so one of the first steps is really gathering data and looking into the issue. And then kind of the next step, and we've seen a lot of states do this really well, is developing language access and interpretation and translation plans within agencies. And this is something that any states that are accepting federal money for certain federal programs like food assistance, known as a Supplemental Nutrition Assistance Program, or SNAP. When New Mexico, because we receive a lot of that money from the federal government, we really should be having language access plans to help ensure that all of our folks in our communities are able to access those. So developing really robust language access plans is something that we've seen other states do really well in those state agencies. Developing systems to where there can be multilingual interpretation services available for families, contracting with translation services so that all documents can be translated into a number of different languages in our state. Those are things that are really crucial to do. And unfortunately, like I said, we came in kind of with a challenge even before the pandemic, where we're really trying to rebuild agency capacity to take on this work. And then the pandemic hit. And while we acknowledge, what a massive challenge that has been, we still think that this should be a priority. And one thing I'd also lift up, because you talked about success stories, that New Mexico is kind of a success story. We're really leading the way on some policies that are benefiting our communities across the state. And a couple of ways we saw that over the past year was that policymakers took important steps when policymakers realized that 70,000 New Mexicans were being left out of those federal impact payments because they lived in mixed status families. One of the things that the state and numerous local governments across the state did was create funds using federal emergency relief dollars to help support all of our families, to help ensure that families, regardless of their immigration status, were able to access these really important benefits that provided a lifeline. Another place where we're leading the way on policy, really crucial policy, was that during the legislative session, we passed some tax policies that provide over $100 million a year, every single year, for families in our state. That's an additional benefit of every single year, $100 million more dollars that will go to families now eligible, regardless of their immigration status. If they're working in New Mexico and they hold a low-wage job, regardless of immigration status, they will see that tax cut. And so these are things that we're really kind of on the cutting edge of leading the way of how you put families in our communities first in policy making, especially in tax policy.
Okay, speaking of policymaking, lawmakers in New Mexico are starting that budget writing process right now in our state. The projections have been pretty good right now due to pandemic relief at the federal level coming into New Mexico in dollars, and also the rebound of the oil and gas industry. Of course, we never know what could happen with that industry or the economy during this pandemic, but right now the budget forecast is pretty positive. The upcoming legislative session is going to be a 30-day session, so it's going to be just really heavily focused on the budget. What are some things that you think lawmakers could address during this upcoming 30-day session at the beginning of next year?
Mm-hmm. Yeah, I think it's a really interesting time for policy because, as you said, we do have a lot of cash on hand. And one of the things that lawmakers should be cautious about as they're thinking through this, and one thing that's good for all folks to know in our state is we're seeing, there's big numbers, money on the board that, theoretically we have available, but the thing is a lot of that money is one-time money. It's temporary money coming in from the federal government for relief. So the way that that's budgeted should be budgeted on programs that are one-time or that will benefit from one-time cash infusions. So non-recurring spending. Then the other element that you talked about that we've seen a recovery, at least a temporary recovery of our oil and gas revenues, which is a huge part of our general fund budget in the state. And so right now we're kind of at a boom time. Oil and gas revenues go up and down over time, and we're kind of at a peak right now. And so that means we have this unique opportunity where we do have a lot of revenue on hand, and that comes at a time when so many New Mexicans are facing really crucial challenges. And so one of the things that we hope is that with that recurring money, that we continue to build out the programs that we know matter most for kids and families. Foremost, that we're really continuing to invest in our education and in our early education systems, that we're ensuring our kids have the support that they need, that our teachers have the support that they need, that our schools are really well resourced so we can create that better future for that future workforce, for our future leaders. Another element that we lift up is we're optimistic that the state is taking some extra steps to expand healthcare coverage for mothers postpartum. That's really, again, crucial for kids and families in our state, especially low-income kids and families. So we hope to see that funding is put towards those issues. When it comes to how we can support immigrant families and families really right on the edge of meeting those basic needs, we really hope that we'll see additional cash relief for immigrant families in our state, families who have still in some cases been unable to access those federal relief programs, families who in some cases may not be receiving those federal child tax credit additions that many families in our state got. We estimate about 95% of the families with kids in our state receive those, so that's excellent, but still some families aren't. And then food security, that we know that continues to be a major issue, and we've seen that that's been really highly prioritized by the administration, the governor's administration, as well as policy leaders. So we're happy about the prospects for that.
Okay, Amber, unfortunately we're out of time, but I want to thank you so much for joining us. Amber Wallin is Deputy Director for New Mexico Voices for Children. Again, Amber, thanks for joining us.
Thanks, Anthony.
And we want to thank you for joining us on another episode of Fronteras, Changing America. I'm Anthony Morneau. We'll see you next time.